Hello students, welcome to BookmarksEducare. Today we are going to talk about reproductive health. So let's first figure out what reproductive health means. So according to WHO, what is WHO? WHO is World Health Organization. Okay. So according to WHO, reproductive health defines every aspect of your reproduction, as in emotional, physical, social and behavioral. All these kind of aspects combined means reproductive health. So if any of this topic, as in your physical health, meaning all the organs that are related to your reproduction, their health, your mental health that is related to reproduction, then behavioral and social, that is also very important, as we human are social beings. So all these aspects when combined means reproductive health. So this is like the whole definition. You guys can take a screenshot and see, go through with it. So let's see why we need reproductive health. Because as we reproduce and create our new generation, there are various aspects of it that changes with our social and behavioral aspects. Okay. So when we reproduce, the only purpose as human, all the animals, the purpose of reproduction is just creating new life and passing on their genes. But as we human evolved our cognition, right now for us only passing our genes to the next generation is not the only goal of reproduction. Through reproduction we create the new life and then we nurture. Human is the animal who provides most parental support to their offspring. No other animals. There are many social animals who provide parental support, but human in that aspect is the highest. As in, throughout your life, your parents are taking care of you. They are guiding you in life. They are giving you advice, and not only parents, our family, our extended family, all take parts in not creating that life but sustaining that new life. Okay, so need for reproductive health, population sization and birth control. Meaning, right now we see most of the countries having a population boom, right? Why? Because uncontrolled population. So we need to control that. Also, we need to have a stabilized population so that our population doesn't decline. What is this? This is a age life pyramid which is inverted. That we will study further in our population topic. So let's move on. Contraceptive methods. Contraceptive method means the process or the methods which we use to stop reproduction. As in, to stop when having sexual activities, some people may not want kids. So this is a process, this is a method by which we can choose to have or not have kids. Medical termination of pregnancy, that is also very important. What happens is that sometimes pregnancy is unwanted. Sometimes pregnancy is causing some difficulties, physical difficulties and health difficulties in mother. In all those cases, parents can choose to terminate the pregnancy with proper terms and conditions. You cannot just expect a new life to be born and then decide it to die. But if you have valid reasons, there are guidelines which we follow, we will see in the later slides. And through those guidelines, you as parents, not you maybe, but any parents who are creating the new life, they can choose to terminate that pregnancy. infertility and assisted reproductive technology. That is also a very important aspect of reproductive health and medical technology. See, there may be some people who are having some kind of sterility issue, fertility issue, whatever it is, or so they cannot conceive. Conceive meanings, conceive is the spelling CONCEIV, CEIV, conceive. Okay. In conceive means to have child. Conceive is the process. It means to have child. So there may be some problem with conceiving, and through ART or assisted reproductive technologies, doctors can help those parents who are having problem with their conception to create a new life. And sexually transmitted diseases. This is a very important thing. Again, all these three things, MDP, ART and STDs, these are the good and bad of reproductive health. If we perform sexual activities and that is like uncontrolled or not to the standard as in, of course, if you are doing something, you have to be aware about it, you have to take focus in it. So if you don't, there is a very good chance of transmitting sexually transmitted diseases, as if these diseases cause and affect your reproductive organs directly. We will see all those things. So components of reproductive health: healthy reproductive organs, safe sexual practices. These can lead to this. Okay. Unsafe sexual practices is the leading cause of STDs. Freedom from STD. As in, see, we as human beings have already eradicated polio. How? By being aware about it, by practicing all the medical guidelines. Same way, if we can dream, if we practice safe sex and we are aware about our sexual reproduction knowledge and all those required knowledge about sexual activities, we can dream to have a world where STDs are eradicated. And access to contraception and family planning. See, you can have contraception, you can have ART, all those things will help you to have or not have a family. So, need for reproductive health in India. Let me adjust these slides a little bit because there are so many information, so I could not attach it to the board perfectly. I will move the slides and show you. India right now is the highest populated country in the world, which is a good thing, as in we have the most human resources. At the same time, this is also a bad thing because we know Darwin said the resources of the world is limited. So, resources of the world is limited, so resources of the world are limited. So, we cannot have too much population. So much so that the resources we have as a country is getting smaller in the aspect of population. So, we, India as a country, need to have some controlled birth programs and everything that governments are practicing nowadays. And also that family planning, population growth, rapid growth. See, you can see rapid growth of population from 36 crore to 121 crore. And that is also the data from 2011. If we see the data in 2025, this number also increased in a huge amount. Also that death rates, infant mortality rates, maternal mortality rates. Maternal mortality rates mean there is always some complication that can happen through the pregnancy and when childbirth is occurring. So the health of mother sometimes gets compromised, and that is what gives rise to the mortality rate of mother. So all these things are very important and crucial aspects that we as human beings, we as social animal should consider. So our government takes effort for reproductive child care. Okay. Reproductive child health program launched in 1997. हम दो हमारे like I say कि if we continuously reproduce and keep reproducing, then the resources are limited. So the amount of resources will never be able to satisfy the amount of people that we host as a nation. Etiology of population explosion. Etiology means the source or the core reason. So etiology of population explosion, students are required to analyze the causes of population explosion, which paradoxically stem from the advancement of human welfare. Meaning, as we human evolved, our medical science evolved. Like in 2025, our medical science is it evolved without bounds, right? There are so many diseases that we can deal very easily. Yeah, you can say for argument's sake, cancer is a disease that we cannot deal easily. But at the same time, if we see 1960s, 1970s, common cold was a very important cause of death, right? Common cold hua, people died. Right now, common cold is something we don't even consider as a disease because you have multiple medicine, very low price medicine available to cure common cold. Same many diseases that can be cured without like very less effort. So, as human evolved, our society evolved, our medical science evolved, our death rate decreased. So when our death rate decreased, at the same time our birth rate increased. So what happened? If this is getting up, number of human being born is getting up every year, and same time number of human dying is getting less, obviously we will have increasing number of human beings. So this is यहाँ पे वही लिखा हुआ है gist में कि why population explosion होता है. Human welfare advancement, rapid increase of population is not merely a result of increased birth rate but significantly a consequence of declining death rate. Just like मैं जो बोल रहा हूँ आप वो सब फॉलो कीजिए, समझिए. This is written है यहाँ पे, आप लोग स्क्रीनशॉट ले लीजिए and you can go through with it at your home at your leisure. आप अपने टाइम से देखिए और इनमें से नोट्स अगर बनाना है आपको बना सकते हैं. This is the whole concept and whole knowledge you need to have for your 12th. But मैं जो बोल रहा हूँ, those are the actual core reason and concepts. So वो समझिए. ये आप स्क्रीनशॉट ले लीजिए, बाद में पढ़िएगा. Rapid decline in death rate, declining maternal mortality rate, declining infant mortality rate. All these things क्या हुआ? इसके रिजल्ट से हमारा ओवरऑल जो बर्थ रेट है वो इंक्रीज हो गया. बर्थ रेट इंक्रीज हो गया. तो ये है एक्चुअल रीजन कि आज जाके इतना अमाउंट में वी हैव पीपल. टोटल ग्लोबल का वर्ल्ड पॉपुलेशन इज अराउंड 7 बिलियन. सो दैट इज नॉट अ स्मॉल नंबर. सो उसके लिए हमारे पास कुछ उपाय भी है टू कंट्रोल दिस पॉपुलेशन ग्रोथ. व्हाट? जैसे मैं बोला कि गवर्नमेंट का जो पॉलिसी हुआ था, नॉट पॉलिसी एग्जैक्टली, because India is a democratic country, so we don't set rules on people's life, but that was a campaign that was run by government कि हम दो हमारे दो. Except that we as a country, as a nation, set our marriage age 21 for girls, 25 for boys. Before that, we all know there was child marriages, बाल विवाह जिसको बोलते हैं. So we all know it happened right now also. If you see, if you want to know, you can see there are many like places where still child marriages, बाल विवाह हो रहा है. गवर्नमेंट के पीछे, लॉ इन्फोर्समेंट के पीछे छुप के हो रहा है. So we as a evolving society should stop that. Promote small families and incentives. Use contraceptive. Right. This is also a very important thing because many people who are like having economic trouble and maybe health trouble, contraceptive is a very easy and safe way to stop them or give them the choice of having sex and still not conceiving. Okay. These are very important. See, you cannot treat sex as a taboo because world में अगर 7 billion people हैं, so they didn't came from like you he, right? They didn't grow on tree. People are having sex, but uninformed sex can cause to many problems, social problems, behavioral problems, and reproductive health problems. So it's far better to be aware and educated about sex and sexual activity rather than treating it as a taboo subject and never talking about it. Let's move on. If you want, you can wait. You can take a screenshot, and another thing, as I remember, this information is actually wrong because it is also 21. Okay, 21 for boys and girls. Let's move on. Contraceptive technology. Contraceptive technology means all those technology and let me zoom it a little bit so that you can see it nicely. So contraceptive technology. There are many ways of contraception. All those types of contraception comes under contraceptive technology or mechanism. It may not necessarily means technology as in something related to technologies and machine, but it is more of a techniques or ways. Contraception, contraceptive technology or contraceptive ways. So contraception का meaning है to prevent pregnancy. Let's see. Let's just move on and see. You will understand what I'm trying to say. See, there are some natural and traditional methods which works, but as I said, our medical science improved, our technology improved, we as a human evolved. So, like for health, we know our immune system protects our body, but we still take medicine, right? Why? Because we know this is a way that can while you have your immune system, still taking medicine can help your immune system and kill the disease better. So same way, we will study some natural contraception method, but there is also medical contraceptive methods. Okay, and we as evolved human beings should give those things more priority. Periodic abstinence. Abstinence means, what does abstinence mean? Abstinence means having no sex. Okay, that is like a very good way. You are not having sex, so the chances of you having a kid is less, 0. Obviously, if you do not eat, you do not get protein. Same way, if you do not have sex, you will not get pregnant or you will not have kid. This is a very good way, but again, we as medically evolved beings shouldn't always go for these things. Periodic abstinence का एक और फंडा है कि as we studied in our reproduction chapters, the menstrual cycle. Menstrual cycle में there are phases, right? In those phases, ovum develops, then it comes to the fallopian tube and wait there for fertilization, and when the fertilization doesn't occur, the endometrium wall sheds and people bleed out, right? So in this time, there are 10 to 17 days menstrual cycle may say there is a window as in a time span where females are physically not capable of having kids. Then again, to know that you have to have so much information in your head. So again, as a medically evolved human beings, we should just know these things but not prioritize these things. Coitus interpretus meaning withdrawal method. If you are not ejaculating inside cervix, the male sperm cannot reach the ovum and they cannot fertilize. So all these things are good, but again you should know. Then there is barrier methods. Barrier means you need a sperm and ovum to have a zygote, right? Now, if I create a barrier of any kind between sperm and ovum, what will happen? They cannot form a zygote, right? They cannot form a zygote. So, this is much more safe and sure-shot way of contraception. Let's see some barrier methods and some preventative methods. One is condom. What is condom? Condom is a latex sheet that is designed to create the barrier between sperm and ovum. Okay. What happens? There are two kinds of condoms, male and female. The female one gets inserted into the cervix itself and it creates the barrier of sperm entry. Same way, the male condom is poured over the penis, and what happens? It creates a pouch or a pocket where the sperm gets stored during coitus, resulting the separation of sperm and ovum. Condoms are barrier made of thin rubber or latex sheets. Okay. Then also there are some process of insertion like this. This is a thing called copper T. Okay. What is copper T? You can see this is the T-shaped thing. So this is why it is called copper T. This is a device that is getting inserted into the female cervix. And what it does is it releases Cu plus ions. Okay. And this Cu plus ion that is being released from copper T is toxic to the sperm. So, as sperm enters the cervix, there is ample amount of Cu plus, so the environment of cervix itself is toxic to the sperm, and the sperm mortality happens. The survival level of sperm, the impregnation capacity of sperm decreases. Same way we can see contraceptive pills. Like they are also called as 72 hours contraceptive pills. What happens is when females take these pills, their estrogen and progesterone cycle gets interrupted. What is the purpose of progesterone and estrogen cycle? through estrogen and progesterone, the whole menstrual cycle of female is maintained. So when these pills are ingested and taken up in the body, your estrogen progesterone का जो level है that gets disrupted, so the normal menstrual cycle gets disrupted. Again, all of this results into an unfavorable habitat for the zygote or for the sperm, resulting in contraception. This property is called as IUD or intrauterine device. Property is called as IUD as an intrauterine device. मतलब this is put in the uterus itself. Uterus के cervix में ये रखा हुआ है, so that is why it is called as intrauterine device. यहाँ पे now I guess you can see these are some different type of IUDs. Non-medicated IUDs. Non-medicated means these are physical irritants, meaning there is no chemicals or these are physical irritants, meaning there is no chemical inside the body that is being released like Cu+ in the property. But what happens is they stimulate foreign bodies reaction causing phagocytosis of sperm, meaning यूटेरस को इन डिवाइसेस के माध्यम से हम लोग encourage कर रहे हैं to treat sperm as a foreign body resulting in their death. Same time copper releasing IUDs, right? CUT, copper T, copper 7, Martilode C7375. All of these releases copper ion Cu+ and Cu++, resulting in sperm blockage, suppress of sperm motility, like I said. And there is also hormone releasing. Okay, progestats, LNG20. What happens? These releases female hormones, as in estrogen or progesterone. Mostly progesterone, because the purpose of estrogen is to maintain a cervix health, जहाँ पे estrogen provide करता है base condition to have kid. On the other side, progesterone decreases that ability. So most of the time they releases progesterone. यहाँ पे लिखा है, देखिए progesterone लिखा है. They releases progesterone in various forms, mostly synthetic, because natural progesterone से ज़्यादा stable होता है synthetic progesterone. Through that, the environment of cervix is disrupted. Contraceptive pills, the pill, as I said, you can take it. Progesterone and estrogen का जो level है वो change हो जाता है and functioning through complex endocrine manipulation. We will study when we study menstrual cycle. Then I will come back and tell you again how actually estrogen and progesterone affects that health, affects your uterus in a way so that it can have a kid or not have a kid. Mechanism of action, they work primarily in getting ovulation, implantation, various ways. Okay. Take a screenshot of it. I think it will be good for you. Okay. Take a screenshot. Take a screenshot. Okay. And I'm gonna move. Dosage regimen. Dosage regimens mean, it means number of time to take a medicine. This definitely should be prescribed by your doctors, because you are inhibiting your body's own mechanism of endocrine signal. You are stimulating it, you are changing it, you are doing things to it. So without proper medical knowledge, people should never go for this. Go consult a doctor and then go through these processes. There are some names Shoheli is a Indian produced drug that is a oral contraceptive pill that is available through market. Go consult a doctor and you can get, everybody can get these things. This is a very, what should I say, this is a very effective and safe way of birth control. This was obviously, I said this is an Indian developed drug where Central Drug Research Institute in Lucknow, India. Okay, this is the information that may be asked in short questions. Which group of scientists or which institution developed Shoheli? Chemistry, Shoheli का chemistry देखते हैं चलो. Unlike conventional pills that are steroidal, why steroidal? Because you have to know all of our sex hormones are steroidal hormones. All of our sex hormones are steroidal hormones: estrogen, progesterone, and testosterone. So, when you are putting other steroidal hormones, be it natural or synthetic, those are causing some situation in your body. But Shoheli contains centroma. What is that? Ormiclofloxacin. Look correct है. Ormiclofloxacin है. What happens is it is a selective estrogen receptor modulator or ECRA. What happens is, this is very not that much complicated actually. You guys can understand if you realize. This is a selective receptor of insulin. Okay. मतलब in female body, uterus and other organs have estrogen receptors. Shoheli blocks those receptors of uterus, causing the amount of estrogen that is taken up by those receptors and causing the endometrium growth in uterus go down हो जाता. For that, the environment of your body changes and it is not suitable for pregnancy. So through this, we are not injecting or we are not putting extra hormones in our body. Rather, we are manipulating already existing hormones so that they can act or not act. Dosage, it is called as once a week pill. See again, these are very generalized circumstances. Never think कि because you study biology, you know about your body. Doctors are practicing medicine and learning through a very hard process. Because class 12 biology say you cannot know your body. But again, for your study, this is a once a week pill. Specific regimen is prescribed. See, this is prescribed to take the pill twice a week. These are all very various methods. You need to know the specific patient to prescribe the drugs. Injectables and implants, also you can implant copper like things or estrogen devices in your body, progesterone devices. All those things causes to rupture ovulation, to stop the sperm from fertilizing the ova. Even after fertilization, zygote का implantation होता है, okay, आपके uterus में, वो stop करता है. तो there are various processes. People should be smart and go to a doctor before choosing this. Then there comes surgical methods. Till now we studied physical methods कि barrier provide करो आप sperm and ovum के बीच में. Then we studied chemical methods कि आप hormones का manipulation कर रहे हो, आप toxic environment बना रहे हो, and through that you are stopping the process of pregnancy. Then there comes surgical ways. Surgical ways are very complicated and again simple because by surgical processes you block the way of sperm getting out or block the way of ovum getting out, resulting in non-pregnancy. We know male humans have mass difference, right? Mass difference. These and these are called vas difference, right? Anyway, this vas difference का क्या होता है? Vas difference is the tube or the pipeline through which sperm testis में produce होता है, that we know already. after getting produced, it comes through vas deferens and getting out from your body. If we cut the tube or pipeline through which the water is being supplied, you will not get water. Same way, if we cut the vas deferens and seal it, there is a process called cauterization. Okay, cauterization. What cauterization means is to sealing of things with the application of heat. So by cauterizing a vas deferens, we are sealing the both end of vas deferens and resulting the sperm blockage, sperm bahar nahi hai. Same way, we can cut the fallopian tube. We know fallopian tube. Same way, the way vas deferens is the sperm pipeline. Same way, fallopian tubes is the फीमेल पाइपलाइन इक्विवेलेंट ऑफ vas deferens जिसके अंदर से ओवम यूटेरस में पहुंचता है. ओवम ओवरी में प्रोड्यूस होता है. दिस इज ओवरी. यहां पे प्रोड्यूस होके ये यूटेरस में आता है. बाय कटिंग ऑफ fallopian tubes you are stopping the way of ovum का movement. This is a very safe and actually very used process also of contraception. vas deferens को हम जब रोकते हैं तो इसको वासेक्टोमी बोलते हैं because we have cut the vas deferens. and जब हम फीमेल में fallopian tube को काटते हैं तो it is called as tubectomy. Okay, all these processes are performed by doctors. Now let's see MTP. MTP is medical termination of pregnancy. So what happens? Somebody is pregnant, but their body cannot accommodate the child. Their health is declining. They are not physically, mentally, economically ready to have a child. They are getting many diseases. So they need to terminate the pregnancy by following some proper guidelines. In India, MTP was legalized in 1971, and then there was some amendments done in 2021 for this whole MTP thing. There were some movements and things were done. Before that, this medical termination of pregnancy was used non-ethical. What does that mean? Due to your problems, due to your various health, social problems, economical problems, parents are choosing to not have child. But at the same time, sometimes there are people who are choosing to not have child based on their gender. That is called as infanticide, as in you are killing the infant. There is a difference. This is called as termination of pregnancy. That is called infanticide. You are choosing to not have a kid because of their gender. So all these things came together. People realized, government realized, law enforcement officers realized, and then they amended the law and made a proper law through which you can go through medical termination of pregnancy without infanticide, without being unethical. Okay. There are some grounds for MTP. I'm just gonna put it up. There is some grounds for MTP. Contraceptive failure. Somebody tried to have contraception and it failed. Therapeutic grounds, meaning your body, as in mother's body, cannot handle pregnancy. There may be various reasons. We will not get into that, but it cannot have. So to help the maternal, to help the woman का जो injury है, physical, mental health, to help her, to prevent her from getting worse, they can choose to not have it. Eugenic ground. There is substantial risk from child being born, as in maybe the child, it is actually social situation. Okay, eugenic meaning is the thing that is evolved from social beings. So for social reasons, for physical reasons, there may be some complication as the child is born. So we can choose to have that pregnancy terminated. Safety risk. The syllabus emphasizes on timing of the procedure. MTP, see, as the fertilization happens, zygote takes form, it gets implanted into the uterus and then it starts to grow. As it grows, the implantation takes place much more deeply. Mother's body changes very fast. So there are some guidelines. Up to 12 week or the first trimester as in there are some parts through which the whole pregnancy, the whole 9 months is divided. Okay? The first trimester is the part of where it is most safe for the mother to have the MTP or the termination of pregnancy. After that vascularity that much increase हो जाता है endometrium का कि taking out the zygote or taking out the fetus causes extra harm to mother's body. Again, all these things are medically guided. People do not wake up one day and choose these things. They go through extensive medical procedure. They go through extensive medical journey through which, with proper help of doctor, people decide what to do and when to do. This is a chart of MTP Act का डिफरेंस जो है 1971 एंड 21 के बीच में अब देख लीजिएगा. ओके, पहले it was used to be 20 weeks, then it became 24 weeks. Then registered professional, one registered medical practitioner, all these things are very core of the laws and guidelines. Take a screenshot of this and go through with it with time and focus. Okay, let's move. We have to cover many other aspects also. Now, let's come to the sexually transmitted diseases. Sexually transmitted diseases means a disease which is transmitted through sexual activity. Okay, disease or infection which is transmitted through sexual intercourse, collectively known as sexual transmitted diseases or venereal diseases. You can see in exam questions like what is venereal diseases, name 2 venereal diseases, something about venereal diseases. Do not be like क्या आ गया, हमने तो पढ़ा ही नहीं, हमको तो पता ही नहीं है ये इम्यूनिटी का क्वेश्चन है या फिर ये कहां से क्वेश्चन आया. Do not get confused. Venereal diseases means sexually transmitted diseases or reproductive tract infection. I will go through with this one by one. Let's see. Let me move this slide side. I will come back. Do not panic. Symptoms, complication and asymptomatic carrier. मतलब क्या है? Symptoms. As we are talking about sexually transmitted diseases, these sexual transmitted diseases, that meaning those diseases primarily, again, only नहीं बोलना, primarily they affect your reproductive organs. So it can include itching, fluid discharge, side pain, swelling in the genital region, mostly your genitals. Then there comes asymptomatic. Every disease में asymptomatic people होते हैं, meaning your body is stable enough to stop the disease from growing or to stop the disease from showing symptom, but it doesn't mean you don't have the disease. It means you are just an asymptomatic carrier. इसमें problem जो होता है, asymptomatic people can infect other people without their knowledge and the सामने वाला person both का knowledge नहीं होने के बाद भी they can infect other people. So transmission and prevention while having sexual contact. Primary vector means human. Mostly there are very mild cases where you can get some diseases. Mostly hepatitis B is something that can be transmitted through other means. I will come to that. But except that, All those sexually transmitted diseases, again, they come from sexual activity, uninformed sexual activity. As we grow, as we come to the age of maturity, we as human beings, we as people from 2025, 21st century, we should be aware and knowledgeable about our activities and take informed decision. Prevention is fail-safe prevention is avoiding sexual contact and accept that barrier methods like condom, and another thing that I forgot to write is informed sexual activities. Now let's see this chart in it and we can talk about it in details. These are some diseases I have mentioned. Take a screenshot. First, take a screenshot. If it's not visible, you can tell me. I will increase the slide slightly. Let's see. There are some very common STIs and positive agents. Let's see. Let's go through one by one. Gonorrhea, caused by Neisseria gonorrhea. गोनोरिया रिमेंबर रखना है, मतलब ध्यान में रखना है, याद रखना है. एग्जाम में डायरेक्ट क्वेश्चंस आएंगे, एमसीक्यू आएंगे, ऑब्जेक्टिव टाइप क्वेश्चन आएंगे. कैसे? नेम द पॉजिटिव एजेंट ऑफ गोनोरिया, नेम द पॉजिटिव एजेंट ऑफ सिफिलिस. एक नंबर का क्वेश्चन आएगा, बट दीज आर थिंग्स आइदर यू नो और यू डोंट. बीच में कुछ नहीं होता है कि अगर कुछ होता तो नहीं. If you know, you know. If you don't, you don't. So try to take a screenshot. Again, I'm telling you, take a screenshot, go through with it at your home, and try to remember all these information. Neisseria gonorrhea is a bacteria, and the disease itself is curable. Of course, bacteria. Most of those bacteria is curable by antibiotics. Antibiotics. Antibiotics दे दिया, the bacteria dies and gets cured. Syphilis, Treponema pallidum. Okay, Treponema pallidum is again it is a bacteria which causes syphilis. Chlamydia or chlamydiasis. Chlamydia is a disease which is called by Chlamydia trachomatis. Chlamydia trachomatis, it is again a bacteria which causes chlamydia. Now let's see some viral diseases. वो बीच में मैं आ रहा हूँ. Genital herpes, genital warts. These are caused by herpes simplex virus or HSV2. ये याद रखना जरूरी है. Again, क्वेश्चन में डायरेक्टली आएगा कि what is the positive agent of genital herpes. What type of microorganism causes genital herpes? What type of microorganism causes gonorrhea? So आपको ये याद रखना है, ये याद रखना है, ये याद रखना है. Definitely. That part still optional. If you remember it, it's good. But these three, again, take a screenshot, remember it properly. कहाँ से पढ़ रहे हो doesn't matter. But पढ़ रहे हो, याद रख रहे हो, एग्जाम में लिख के आ रहे हो, that is it. Genital herpes is caused by herpes simplex virus. Genital warts is called human papilloma virus. Okay, this is actually a very interesting virus. I will come in the immunology topic. This HPV also, in some cases, can cause cancer. Trichomonasis is a disease that is caused by Trichomonas vaginalis. This is a protozoa. Okay, याद रखना है. This is a protozoa. बैक्टीरिया ये है, ये वायरसेस है. This is a protozoa. Then again, hepatitis B is called by hepatitis B virus. इससे इसी को नहीं हो सकता. And then AIDS. AIDS is caused by HIV, human immunodeficiency virus. Okay. थोड़ा मैं एड्स के बारे में इंफॉर्मेशन दे देता हूं क्योंकि आता है एग्जाम में. एड्स का फुल फॉर्म है एक्वायर्ड इम्यूनो डेफिशिएंसी syndrome. There are some parts. What is immunodeficiency? What happens in AIDS is HIV virus affects your T cell. Okay, and we know, we have studied immunology already, that T cell is the very active and one of the most important component of your immune system. Acquired immune system mostly relies on T cell and cytotoxic T cell to mitigate the infections. Now imagine the cell that is core of your immune system, that is the main component, main pillar of your immune system, is getting destroyed by HIV. What will happen? That is what happens. Immunodeficiency, meaning deficiency of immune system, as in आपका immune system खुद compromise हो जाता है. Your body cannot fight against other bacteria, virus. That is why it is called syndrome. Syndrome का meaning है multiple types of diseases or symptom एक time. मतलब AIDS actually is not a disease. AIDS is just immune deficiency. Now क्या होता है? जैसे आपका immune deficiency हुआ, other every diseases that you can fight off easily with your immune system, like common cold, those your body cannot fight. तो क्या होता है कि your body, as they cannot fight those bacteria, viruses, other microorganisms, आपका ability to protect your body get decreased. इसीलिए इसको बोलते हैं immune deficiency syndrome, क्योंकि immune deficiency वजह से बहुत सारे लोग एक साथ हो जाते हैं, comorbidity. And why acquired? Acquired because you acquired it through sexual activities. Now let's see ART or assisted reproductive techniques. Why we need it? As I said, there will be various complications to have pregnancy, in sperm mortality rate, sperm का mortality rate होता है, ovum का production rate, बहुत सारे problems हो सकते हैं. तो इसके वजह से we as human beings, our medical science, our doctors produced this assisted reproductive techniques. बहुत सारे उपाय होते हैं इसमें. In vitro fertilization, as in, what does in vitro means? In vitro means outside the body. In vivo means inside, in vitro means outside your body. Meaning you are taking a sperm from the father, taking a ovum from the mother, and the fertilization which is supposed to occur in the uterus, in the fallopian tube, is occurring outside. It is occurring in a laboratory, it is occurring inside a testicle. That is why we call them testicular. इन विट्रो फर्टिलाइजेशन में हम लोग बॉडी का पूरा एटमॉस्फेयर देते हैं, हार्मोन्स, न्यूट्रिशन सब कुछ देते हैं, रिजल्टिंग इन फॉर्मेशन ऑफ अ जाइगोट. एंड देन दैट जाइगोट जो आउटसाइड में फर्टिलाइज हुआ उसको मदर के बॉडी में इंप्लांट किया जाता है. तो ये लिखा हुआ है यहाँ पे कि टेक स्क्रीनशॉट ऑफ व्हाटएवर यू नीड बट रिमेंबर दिस थिंग्स. प्रोसीड्यूर: ओवम फ्रॉम वाइफ, स्पर्म फ्रॉम फादर और हस्बैंड लिया जाता है, एंड जाइगोट बनाया जाता है लेबोरेटरी में. एम्ब्रायो ट्रांसफर: लेबोरेटरी में जाइगोट बनाने के बाद एम्ब्रायो को फीमेल ट्रैक्ट में, एज इन फीमेल फैलोपियन ट्यूब में इंसर्ट किया जाता है, एंड थ्रू दैट ज़िफ्ट होता है. ज़िफ्ट, व्हाट इज ज़िफ्ट? zygote intrafallopian transfer. Intra means inside, intra means, as we said, inter-college competition, intra-college competition. Intra means अपने अंदर, inter means with others. So intrafallopian tube means ऐसे मैंने आपको जो बोला, जाइगोट बनाने के बाद लैब में उसको फैलोपियन ट्यूब में इंसर्ट किया. There are some other in vivo techniques. वो है गैमेट intrafallopian transfer. Suppose there are some blockage or there are some complexity in the cervix itself, so the sperm cannot reach the ovum, or maybe there is some problem with sperm discharge from the male point of view. So what we can do is we take the sperm, then we put it inside the uterus. So that way we are not implanting the zygote into the body, but we are providing external help to insert sperm or gamete into the fallopian. गिफ्ट में हम लोग गैमेट ट्रांसफर करते हैं, जिफ्ट में हम लोग जाइगोट ट्रांसफर करते हैं. स्पेशलाइज्ड माइक्रो मैनिपुलेशन टेक्निक इंट्रा साइटोप्लाज्मिक स्पर्म इंजेक्शन. मतलब इसमें क्या हो रहा है, एक जाइगोट है with a big huge nucleus, not exactly but, and then there is sperm. In this process we are taking micro injections, injection that is so small you cannot even see the injection through your naked eye, and that injection is being put into the zygote in the ovum itself, and the sperm is being released through this inside. An artificial insemination, this is like गैमेट ट्रांसफर, जहां पे हम स्पर्म को आर्टिफिशियली फीमेल में ट्रांसफर कर रहे हैं. लेट्स सी नाउ सम सोशल एंड एथिकल सिचुएशंस. As I said, infanticide, feticide means killing of fetus. Okay, killing of fetus means हम लोग चूज करके fetus को kill करते हैं. What is the difference between a feticide and medically assisted termination of pregnancy? The core difference, again I am telling you, मैं पहले से ही आपको यही बात बोल रहा था, right now also I am telling you, the core difference है यही कि एक में as in medically terminated pregnancy में you are not choosing to kill the kid just because. Okay, आप ऐसे ही यूं ही fetus kill नहीं कर रहे. What you are doing is you are choosing to not have that baby because there are some complications with mother's health, there are some social complications, there are some economical complications, there can be various situations that as we become adult we will realize. So never confuse this with that. So I will come here, I will come to the ethical part, but before that let's see why these ethics are important. This is important because of this process, amniocentesis. What happens in amniocentesis is we take out some fluid from the uterus का जो amniotic fluid है. What is amniotic fluid? One second, there are some comments from student. Hello Tasil Mirza, hi, thank you for watching our videos. आप फॉलो कीजिए हम जो पढ़ा रहे हैं. आप बोल रहे हैं कि कोई लाइव नहीं है, आप तो है ना, दैट इज इम्पोर्टेंट कि आप देख रहे हैं. आप ये सोच लीजिए कि हम ये हमारा वन ऑन वन क्लास है. So this is not important कि how many people are here. It is important is कि as many people are here, they are listening to what I'm saying. You have to understand science. Okay, you cannot just ratify science. You have to understand and realize what is the leading causes, what and why of science. क्यों हो रहा है, क्या हो रहा है, कैसे हो रहा है, ये समझना है. Just because हो रहा है ऐसे हम नहीं बोल सकते कि ये तो होता है. That is not science. So let's see amniocentesis. What क्या होता है? Again, what happens? That is what, how and what. Who, what, how. These are the important things of science. Amniotic fluid is the protective fluid, is the media where the zygote grows, where the fetus stays, and where the baby is protected by mother. In this placenta amniotic fluid में वहां पे आपका सेल से लेके शुरुआत करके आपका क्रोमोसोम्स, आपका जेनेटिक मटेरियल सब कुछ अवेलेबल होता है ये amniotic fluid के अंदर. So by taking this amniotic fluid through a needle, we can do many things. For example, we can know the diseases. Maybe the kid is suffering from genetic diseases. For example, Down syndrome. We all know Down syndrome. I have personally taught you guys in genetics what Down syndrome is. So Down syndrome में genetically changes are. By taking out some amniotic fluid, we can study that fluid in lab and tell what is the chromosomal components of that baby that is being born, how the health of the baby is, which diseases they are suffering from, if not, whether they are healthy or not. All these things we can study from this. At the same time, because your chromosomes are present, this and this is also present. So by which we can tell whether this is a female fetus or this is a male fetus. Right? So you can say that is why that is important. Right? Why it is important is key. As I said before, people are choosing to have or not have kid based on gender. They are. Here these ethical parts come. Okay. एक मिनट फिर से कोई क्वेश्चन पूछ रहा है. Let me see. See, bachcha, the questions you are asking is good. I am not discouraging you from asking question because science is about curiosity. So yes, genetic disorder में भी बच्चा normal delivery हो सकता है. Delivery is not the reason why amniocentesis is done. What is important is कि after the kid is born with Down syndrome, they have to live the life with Down syndrome. After a kid is born with Patau syndrome, Edwards syndrome, Turner syndrome, whatever it can be, they have to live their life, right? You cannot say that a kid should be born and then what is happening with their life you are not keeping track. So delivery is not the goal of reproductive health. A kid being born is not the goal of reproductive health. What is important here in reproductive health is what is happening throughout the pregnancy. What is going through the pregnancy, what is happening before and in between pregnancy with mother, with father, with the sociological structure that kid is being born into. That is important. कैसे सोशल इकोनॉमिकल स्ट्रक्चर में कैसे हेल्थ की मम्मी का कैसा हेल्थ, पापा का कैसा हेल्थ, ये सब बीच में द किड विल बी बोर्न. सो द बर्थ ऑफ द किड इज द लास्ट topic of last scenario of pregnancy, but the throughout pregnancy conception से शुरुआत करके the kid birth का बीच का जो thing है that is much more important or much more talked about in reproductive health. So amniocentesis में क्या होता है? We take out the amniotic fluid and we study it, and by studying it we can know genetic disorders. Down syndrome, hemophilia, sickle cell anemia, Patau syndrome, Turner syndrome, whatever you want. The problem is chromosomal pattern. By knowing XX or XY, people can choose to have their preferred baby, which is unethical. You cannot decide and choose a gender. इसीलिए बैन लग गया है हमारे कंट्री में amniocentesis का. Now you have to know amniocentesis as a whole, पूरा amniocentesis का जो टेक्निक है that is not banned. Okay, only 6 identification of fetus slash kid, not kid, fetus only. Okay, you cannot call that a kid. A fetus is not a kid. Okay, you have to remember it. Scientifically, a fetus is a thing that is not even born yet. Unless it is born, unless a child come out of a womb, it is not a kid. So the sexual identification of fetus, it is okay. Under which act? Under Preconception Prenatal Diagnostic Act. ये हुआ था 1994 में, इंडिया गवर्नमेंट बैंड इट. It covers all the genetic counseling centers, laboratory, obviously. Again, in a regulated manner. You have to follow these rules. और even laboratory का लाइसेंस चला जाता है, मेडिकल प्रैक्टिशनर्स का लाइसेंस चला जाता है ड्यू टू अनएथिकल प्रैक्टिसेस. Prohibition, again, it strictly bans sexual selection before or after conception. You cannot choose to have a specific gender. All this reason is female feticide. बहुत टाइम से, right now these data are getting balanced, but बहुत टाइम से per 1000 मेल में there wasn't 1000 female, there was less than 1000, around 600, फिर वहां से 800, ऐसे increase हुआ after banning. But with this data we can see every 1000 male child born, there is not every 1000 female child born, meaning people are choosing to have more male child than female child, and that is the whole cause of this PCPNDT Act, as in preconception and prenatal diagnostic techniques. Take screenshot and you can see later on also. Let me take it a bit down. छोटा सा छोटा कर देते हैं ना, ऐसे आप एमिनोसिंथेसिस का एक स्क्रीनशॉट ले सकते हैं and then see. Okay, now let's see. This is all about our sexual health, reproductive health. So क्या पढ़ा हमने, क्या सीखा कि why sexual health or reproductive health is important? Because of the physical, mental and sociological structure and situation of parents. Then हमने क्या सीखा, कैसे contraception होते हैं. Contraception मतलब the prevention of pregnancy बहुत तरीके का होता है. Barrier method जिसमें हम लोग sperm और ovum के बीच में barriers लाते हैं, and then there comes some chemicals method, and then there comes surgical method. आफ्टर दैट हमने क्या देखा कि सेक्सुअली ट्रांसमिटेड डिजीजेस क्या होते हैं, बहुत सारे होते हैं STIs. अगेन रिमेंबर दोस डिजीज का नेम, उसके साथ उसका पॉजिटिव एजेंट एंड पॉजिटिव एजेंट का टाइप, ये सब याद रखना है. एंड आफ्टर दैट हमने एथिक्स के बारे में, सो यू शुड स्टडी इन होम आल्सो. आप देखिए जो समझाया मैंने उसका ऊपर आप थोड़ा पढ़ाई कीजिए. And this is the information about our BookmarksEducare. You can contact anytime in this number in the office hour, obviously. Do not call at night, okay? I know some of you are like that. Do not call. Right? आप call कीजिए office hour के बीच में, and there will be always there will be some people to help you with your situations. You can visit our website www.bookmarkseducare.com. वहाँ पे आपको हमारा क्लासेस का स्ट्रक्चर, कोर्स का स्ट्रक्चर, ये सब कुछ मिल जाएगा. सो थैंक यू. आई विल आंसर सम क्वेश्चंस और जो बातें हैं. ओके, सो तस्वीर मिर्जा, यू आर विथ मी. आपने पूरा क्लास मेरे साथ रहा, ऑल्दो यू आर फ्रॉम 10. सो आई एम नॉट गोना टेल यू कि आप बस 10 का ही पढ़ाई कीजिए. साइंस इज अ होलिस्टिक कॉन्सेप्ट. होलिस्टिक का मतलब है सब कुछ एक साथ. आप अगर केमिस्ट, अभी आप 10 में हैं तो ये सब कुछ समझना जरूरी है. आप पढ़ रहे हैं फिजिक्स, केमिस्ट्री और फिजिकल साइंस, केमिकल साइंस, बायोलॉजी, मैथ, सब आप अलग-अलग पढ़ रहे हैं. बट जैसे आप बड़े होंगे आप रियलाइज करेंगे कि एवरी टॉपिक इज रिलेटेड टू द अदर टॉपिक. फिजिक्स के बिना कोई भी केमिकल एग्जिस्ट नहीं कर सकता यूनिवर्स में. अगर फिजिक्स के बिना कोई केमिकल एग्जिस्ट नहीं कर सकता, सेम तरीके से अगर केमिकल्स नहीं होंगे तो ह्यूमन बीइंग, लिविंग थिंग्स कुछ फॉर्म नहीं होगा. और मैथ के बिना हम लोग फिजिक्स कैसे हो रहा है ये समझ नहीं पाएंगे. तो आप पढ़ाई कीजिए, आप 10 का पढ़ाई ऑब्वियसली फोकस देके कीजिए, बिकॉज योर बोर्ड इज क्लोज. वी आल्सो हैव 10 क्लास का टॉपिक्स, हम लोग 10 क्लास कवर करते हैं. मैं खुद आऊंगा 10 क्लास का बायोलॉजी पढ़ाने. आप वो भी देखिए। कल टुमारो सुबह आप आ सकते हैं 11:30 और 12 ऐसे वक्त में। हमारा 10 क्लास 10 का आपका लाइव होगा। हमारा बायोलॉजी एजुकेटर रहेगा पल्लव सर। यू विल एंजॉय दैट क्लास आल्सो। सो थैंक यू। क्यूरियोसिटी अच्छा है, क्यूरियोसिटी रहना चाहिए एंड पढ़ाई करते रहना चाहिए। बी क्यूरियस, फॉलो बुकमार्क। ओके, गुड बाय, थैंक यू।